Hello, good day, good afternoon. It's lunchtime here in Amsterdam and in the UK, but it could be evening if you're in Asia. Or if you're getting up super early in the Americas, thank you very much for your attendance today as we look to understand CBT, cognitive behavioral therapy. It's all the rage in psychiatry and psychology as it's been for many years. And we have an expert here today, Dr. Angel Garcia. Welcome, Angel. How are you today?
Thank you very much, Joseph, for this invitation. It's always a pleasure to be working with you guys and trying to disseminate scientific knowledge of this amazing field, which is psychology.
Well, exactly, and it's certainly interesting for me, and I'm an MBA student, so it's interesting for me to look at this, from maybe an organizational psychological perspective, or looking at people around the office or in teams and how they behave as well. So it's very interesting to look at CBT as kind of a practical way at looking at some of the problems that we have and how we can look to solve them. So thank you very much, Angel. You're teaching at the moment. You're actually lecturing on our CBT module. Is that correct?
Yes, well, that was kind of like a previous module that I've done, but yes, I'm doing that one. But currently, we are delivering the mind, brain, and behavior module, which is like very interesting as well.
Mind, brain, and behavior. Okay, so
yeah.
Well, this is an interactive session, Angel. I asked you some questions about, what is CBT all about? What do you do in a CBT session? And you replied to those questions. We've got quite a full webinar to get through today with loads of questions about CBT, cognitive distortion, and kind of key techniques that are used. So we want our audience to pay a lot of attention in this session. You're going to get out of this session what you put into it. So please all have a question ready for about 40 minutes time as we'll go to Angel in our Q&A. So that any people looking to do clinical psychology, this is definitely for you. And please have your questions ready for us as we go through our questions for Angel today. So thank you, Angel. As we start with, what are the origins of CBT?
Well, this kind of, like I said, therapeutic approach was developed around the 1960s, and this was kind of rooted in the works of Aaron Beck and Albert Ellis. So bear in mind that from the 1920s until the 1950s, there was like a prevailing paradigm, which was behaviorism. So behaviorists were like all over in the field of psychology. But then Aaron Beck developed this cognitive therapy, and whereas Albert Ellis was developing the rational emotive therapy, and then combined, they brought together the cognitive behavioral therapy. So Aaron Beck actually realized that most of our problems were grounded in the way in which we think, in the way in which we process the information at cognitive level. So his principle is the ABC, where you have the A as an activating event, you have the B as a belief, and as a C you have as a consequence. So he suggested that the way in which we think about a certain event, situation, person, object, clearly impacts the way in which we're going to behave, because we have the beliefs as a mediator. So depending on the way in which we think about a certain thing, situation, object, or person, then we will act as a consequence.
Wow, activation, belief, and consequence. So when was this developed by Beck?
Yeah, well, he was starting to do research in the 1960s because he was a psychiatrist, and then Albert Ellis, who was a psychologist, and then they put together all this research, and he started actually doing a lot of research with his own patients, and he has produced a range of empirical studies which have proven or have shown that this approach is quite effective for a range of disorders like anxiety, depression, etc.
Very different indeed from the psychoanalytical approach that people might be familiar with from Freud, right? It's a very different approach, wouldn't you say?
Yeah, exactly. That's a very good point, because actually this sort of like trend in the psychological field was born kind of like as a response of the psychodynamic view prevailing back in those days by Freud, right? Because this is not seen as behavior is not seen as unconsciously driven or based on sexual desires, as Freud suggested, but it's more focused in the way in which process the information. So it was kind of like a revolutionary way of thinking as well, because we were like so stuck on thinking about unconscious processes as stated by Freud. But then Adam Beck realized that the way in which the patients were in his private practice were processing the information around them was actually triggering a range of behaviors. So they were triggering as well, like the way in which they feel. So they were like feeling sad, they were feeling like angry, they will feel like happy. So that he realized that all those kind of like emotions were rooted in the way in which they were processing information. So it's quite different view from psychoanalytic perspective.
No, I like the idea of a kind of rewiring of our thought process. Let's look at a CBT session then, and kind of the nuts and bolts of what happens within a session. What can you expect, Angel, if you're going to a CBT session, or if you're a therapist conducting a session?
First of all, we need to be clear in that the CBT model proposes that the psychopathology is a product of false information, right? Processing that manifests itself in distorted and dysfunctional thinking. Secondly, CBT therapist helps the patient to identify, evaluate, and then modify distorted cognitions to produce kind of like more realistic and adaptive evaluations, right? Let's take, for example, like if you're like in your workplace and then you think that well, you know, my boss thinks I'm a failure. And then this person is going to be thinking like, oh, no, I'm a failure, I'm not very good at this. So therefore, she might develop, or he might develop some sort of anxiety. Therefore, as a consequence, she or he will behave in the way that she wants to avoid that. She don't really wants to deal with the boss, or because she thinks that the boss thinks that she's a failure. So basically, we are helping patients to first identify these patterns, these thinking patterns, in a way to change them. And as a consequence, we are all going to be linking as well the behavioral patterns. So how our reasoning and our thinking triggers behaviors. So we need to identify them at the beginning, challenge them, and then kind of like restructure the cognitive skills that we have. So you need to develop this like therapeutic relationship with the client since the beginning of the session, which we call rapport. And it's very important, because bear in mind that the client is going to you because you are the professional, you are the expert in these matters, and therefore he or she truly trusts you. So whatever you said, whatever you think, wherever whatever strategy you use with this patient, they're going to fully believe in that. Then you would establish the goals with the client, and these goals are actually set by the client. So we need to evaluate kind of like the main things that he or she want to work on based on the problems that he or she thinks that she or he has, right? And then we develop a schema formulation, and then we go on to focusing on the present. So rather than, I mean, compared to the psychoanalytic perspective, where in a psychoanalytic session, you would go backwards and backwards in order to unravel kind of like the childhood traumas, as Freud suggested. In the CBT therapy, you focus on the present. You are actually focusing on the way in which the person is perceiving his or her world right now, in a view to identify distorted thinking, and in order to evaluate them, in order to help him or help her to challenge such assumptions and beliefs, and therefore we can move on to restructuring his thinking or her thinking. And then we go to number 4, which is the structure, and then we will develop an agenda of topics that you're going to be analyzing during each of the sessions. And then you go into the formulation, which is the development of a model of a client's problems to work on. So this is like a very active process. This is like a very interactive process, whereby you are like kind of like guiding the sessions. But as you guide the sessions, you're actually working with the material that the client gives you. So this actually kind of like the structure of the CBT.
I mean, it's quite interesting how many parallels there are to a kind of consultative business relationship in many ways. You know, it's very practical. You know, in any consultant will have to, you know, establish a kind of relationship with their client, would have to establish goals, look at a problem, whether that's organizational, focus on what can be done now in terms of small steps and increments. So it has kind of a lot of, you know, very kind of project management, each small steps, small wins, very logical way of addressing people's problems. Would you say that's accurate?
You know, that's a perfect example because in the organizations, you're dealing with people, you're dealing with beliefs, you're dealing with behavioral patterns. So whenever you have like different situations in a given organization, well, it's down to the way in which the employees are dealing with the you know the workload that they have in the organization, and therefore their beliefs and the way of thinking and the way of behaving is going to be reflected on the work as well. So of course, no wonder why we have problems in organizations, right? Because we're human beings, right? And it doesn't mean that you're a good person or a bad person. It just means that you have a different a range of influences, a range of factors which actually influence the way in which you were educated, you were raised, and how you conduct yourself in this time of life. So yeah, that's very important example, Joe.
Okay, perfect. So let's go from organizational distortion into cognitive distortion, and we're going to race through. I think we've got 15 different types of cognitive distortion. So let's kind of try to role play them out and see what kind of scenarios you'd get in if you were kind of displaying some of these distortions. And I'm sure we all display these distortions. When I went through these, I thought, oh, I do that. I do that occasionally as well. So let's look at the first one as we get the big old brain up here. Polarized thinking. A person with this dichotomous thinking pattern typically sees things in terms of either or. Something is either good or bad, right or wrong, all or nothing. Black and white thinking fails to acknowledge that. There are almost always several shades of gray that exist between black and white. Is this quite a common issue in patients?
Yeah, this is very common. The polarized thinking is like whether you do the things right or wrong, whether you are like a good person or a bad person, whether you're like you're being like a very good husband or wife or employee or son or cousin, but the person fails to acknowledge that there are like little factors which can be taken into account in order to provide this kind of like judgment.
Exactly. Yeah. This you define yourself by certain goals, and you know, someone always told me the best way to make yourself miserable is to assign yourself goals, and and then once you assign yourself goals, you say, well, I'm good or bad. I either A, passed this goal, or B, didn't pass this goal, and then you judge your character based on a goal that you constructed yourself. This is kind of manifest destiny effect that we produce on ourselves. Generalization, seeing a pattern based on a single event or being overly broad in the conclusions we draw. What is a good example of this?
Yes, one of the good examples, like for instance, if I didn't succeed. I wanted to get a promotion, but I didn't succeed the first time. Then I'm going to say, like, you know, I'm never gonna do it. I will never gonna do it. I will never get a high salary because I'm rubbish. And then I'm not gonna apply. That applies in the organization. But if you go back home or you go with your friends in the neighborhood, and then you keep thinking the same, like, I'm not very good at this. I'm not gonna do that because I'm rubbish at applying for grants or applying for or getting into the gym. I don't know, they're going to reject my application to the gym because I'm rubbish. So you generalize just based on one specific situation or event, overgeneralize that you're applying to all your life. And that's actually which makes you miserable, because you'll think that this person will think that it's not very good or she's not very good at anything.
Exactly. Or we could jump to conclusions. If I just go to the gym twice a week for the rest of the year, I'll lose the weight that I need to, and I'll be happy. All I need to do is be happy. There's two types of jumping to conclusions. Mind reading. Imagine we know what others are thinking. My wife will be happy if I go to the gym twice a week. That's what she needs. She needs me out of the house. She wants me to lose a bit of weight. I know that's what she wants. Or fortune telling, predicting the future. And if I do that, then she's going to be happy and everything's going to be all right. do we jump to conclusions a lot?
That's really funny. Yeah. Maybe you're going to apply to the gym because you think that your wife thinks that you're a fat guy or something. But that's not true. That's not true. Maybe your wife, is thinking about, like, I don't know, I want to get a promotion in the job, but I'm not going to get it because I'm not very good at that. So it repeats itself. It repeats itself. But yeah, jumping to the conclusion is like, it's very tricky because the individual assumes that he knows or she knows what the other people is thinking. Now, so my voice is thinking like I'm not very good at this, so I'm not going to do it, and therefore you're going to feel like anxious about that, and therefore you're going to develop some sort of like psychosomatic stuff, or fortune telling. Now you're predicting the future, like I'm going to do this, I'm going to do this interview because I haven't got a job, but I'm not going to do very well in the interview because I haven't been good in the interviews in the previous years, and therefore that's my destiny. And the implications of this is that you're being predisposed by your own thinking to failure, because you're going to think that you're not very good at that. Well, if you think that you're not very good at that, well, of course you're not going to be very good at that.
If you build it,
but the opposite happens as well. Yeah. But the opposite happens as well. If you think that you're like really good at, I don't know, producing a memorandum or producing a different report in your organization, and then you feel like you're efficient, well, that could be the positive side of jumping to conclusions.
And we've got a bit of that as well, filtering, only paying attention to certain types of evidence. So there you go. It's interesting as we go through this stuff, we talk about mental health problems, but I mean, I think that's just kind of a negative way to look at it. As we look at these cognitive distortions, I think it's clear that we all have mental health issues or cognitive distortions ourselves. Every one of us has done this, filtering or generalizing. We've all done it to some degrees. It's just the nature of which it becomes your obsession, or it dominates your overall thinking pattern, and then it makes your life difficult in the day-to-day. Catastrophizing, blowing things out of proportion or inappropriately shrinking something to make it seem less important. What's a good example of this?
Yeah, catastrophizing, like I'm not gonna be able to meet the deadline for this memorandum that I need to hand in, and therefore they're going to have to fire me.
Yeah, the worst case scenario.
That's a very good example. The worst case scenario. Exactly. You are like focusing on the big catastrophe that's going to happen because of the way you are like behaving, because of the way in which you are doing the things. So that's going to have a negative impact on yourself as well, and on your performance.
What is personalization?
This is where a person, an individual, may attribute things that other people do as a result of his or her own actions or behavior. So this type of thinking, for instance, also causes a person to blame himself or herself for external circumstances outside personal control.
Wow. And let's go on to the next one. We've got control fallacies. Okay, so this is an interesting one. Someone who sees things as internally controlled may put himself or herself at fault for events that are truly out of the person's control, such as another person's happiness or behavior. Is there an element of God complex here with this?
This is very clear. Whenever, for instance, you think you're responsible for what other people might feel, might think. So I'm responsible because my girlfriend, my boyfriend is quite sad, and so I'm provoking this sort of things in my boyfriend or girlfriend. But you don't have control over that. Your boyfriend or partner or boss or sibling or son or father, they will have their own factors influencing the way they think. So in this control fallacy, you think that you can have control of the other stuff, but no, really, you can't.
It's the illusion of control. The fallacy of fairness. So these are all illusions, really. This fallacy assumes that things have to be measured based on fairness and equality, when in reality things often don't always work that way. I often say...
Has that happened to you, Joseph?
all the time. Well, you know what I think is interesting? I always say to someone, if someone, an individual, is being illogical, one of the worst things you can do is try to rationalize yourself or approach that with logic. And go, well, if I just do this, then this is going to improve our relationship, or this is going to help that person because I could see these logical steps, and I've rationalized that, and so I'll be able to go and help that person. But if someone has certain delusions and isn't logical, then you can't approach everything rationally, and this fallacy of fairness seems to kind of have that. Things aren't always just fair. It's like the black and white, the polarization. Things aren't always fair. Things, if something's here on the left hand, the scale doesn't always balance on the right. Would you say that's fair? a fair comment?
This could actually be upset for instance, if you are in your workplace and then you see one of your colleagues who got a promotion, then you think that, oh, why? I've been working harder than that she has been working, and she got promoted, but I didn't get promoted. So that's unfair. That should have happened to me. So these guys are not like putting value on the things that I'm doing. So that's again. So now you're personalizing it, and then you're the fallacy of fairness comes into play as well. So there's a lot of this. Like, don't think about this cognitive distortion as like just happening separately. Sometimes they're like quite strong links, and one thing leads to another, one thing leads to another. So,
because you start doing this, you start catastrophizing and turning things into the worst case scenario, and then you do blaming, the opposite of personalization. Instead of seeing everything as your fault, all blame is put on someone or something else. I'm sure we all know.
That's a very interesting one. That's a very interesting one, because, like, whenever you don't want to like assume responsibility, then you can just blame everyone but yourself, because and eventually that happens in your job. Like, who's responsible for these webinars, Joseph? You?
Not me, it's Michael. Sorry to introduce Michael. It's Michael. He's our producer. So we can make disparaging comments about him because he's not here. We can blame, externalize. But this very interesting.
Let's blame Michael.
We had one of your students in a few months ago, won the dissertation and the Student of the Year award for psychology program, Angel. His name was Simon Crome, and he looked into corporate psychopathy and executive psychopaths. And blame externalization was also a key component to the psychopathy scale of what made people psychopaths: narcissism, fearlessness, social influence, and one of them was blame externalization. So it can be quite dangerous. Revisionist historianism is another one. You have a great day and then you rewrite that day as one of the worst days of your life. That's something that
yeah. And you know what, the funny thing about that is that everything happened in your head. So the mind is really interesting, and it's really smart as well. Whenever you see that something didn't go as planned, but in order to protect yourself, and you say like, well, it was my fault. Well, you can just blame other people.
Change the events.
They should have, they changed events, and they should have. That connects to the cognitive distortion. They should and musts and ought to, because they should have been like more fair with regards to promotions. I don't know. They should have given me the grant that I was looking for research, or my teenager should have got better grades because I think he is smart or she is smart. Yeah. So they should put the individual in a very difficult position, because that suggests the should and the must gives you the strength and the motivation to do something that you think you should do, you must do, but it doesn't have to be that way. And bear in mind that all this cognitive distortion, they just don't come out of the blue. There's a lot of factors which influence the development of these cognitive distortions. One of the primary factors for the development of this distortion is like the early years experience. So you are, as a child, whenever we're working as a child with children, and you can really see the patterns of adults reflected in the children's way of thinking. So you can actually detect, identify some sort of distortions even with 5-year-olds, 6-year-olds, 7-year-olds. So the only thing that tells you is that children, as whoever human beings, we are like learning from our environment. We are learning from the people, from the caregivers, or dad, or mom, or grandpa, or grandma. And those sort of like cognitive schemes stay for life if they are not treated, if they are not worked, and if they don't work with a counselor or a psychotherapist. So yeah, difficult task.
Yeah, I'm not where I need to be in life because someone should have done something, but they didn't do that, and that's why I'm not in that position. Emotional reasoning.
Yeah.
What's this? What's emotional reasoning? I'm sure we all do it as bargaining as well. What's emotional reasoning?
Yeah, and this is like whenever you are like your decisions are driven by emotion. So if you feel scared, for instance, and therefore then you process that information as oh, there's a real danger in this situation. There's a real danger in my office because maybe they're going to fire me because I feel it and I feel like quite sad. So maybe they don't see me as a happy person as they would like to, and therefore I'm just trying to. Sorry, I'm trying to make decisions based on the emotion that I'm feeling. And that could also trigger, I don't know, a range of thinking, which links to catastrophizing. Because I think that, like, well, I feel very, I don't know, I feel stressed, I feel anxious, and therefore they're not going to like me. So maybe they're going to fire me. You see, so all these things continuously happen in our mind, and the individual keeps repeating himself or herself all these thoughts that come to their mind, which we call cognitive rumination. So this is like this is where we can insert another term here, which is reinforcement. So the way in which behaviorist therapy works is that you have a stimuli and then you have a reinforcement, right? And therefore that would reinforce the kind of like the behavior that you're doing. This happens the same with the mind. So if you think that you are going to be fine because you are like a rubbish at your job or because you're not very good at what you're doing, and you keep reinforcing that same idea on your own. Unfortunately, if you're not able to identify that, you will keep doing this for your life. 50-year-old, 60-year-old, 35-year-old, 70-year-old, those cognitive skills will prevail.
Exactly. I mean, and the older you get, the less likely you are to be able to change as well. And the fallacy of change, the distortion assumes that other people must change their behavior in order for us to be happy. So it's kind of almost a blame externalization on behavior itself. You know, we have global labeling and mislabeling. You know, this distortion is a more severe type of overgeneralization. It occurs when a person labels someone or something based on one experience or event, which is, you know, that must take a while to reverse something. Always being right, I think, is the thing I suffer from the most. I'm sure my producer's laughing there. This thinking pattern causes a person to internalize his or her opinions as facts and fails to consider the feelings of the other person in a debate or discussion. So it's always be careful about always being right. And one thing I thought was extremely interesting, this one, heaven's reward fallacy. What's heaven's reward fallacy, Anga?
Well, this one is people experiencing this distortion tend to put their interests and feelings aside in hopes that they will be rewarded for their selflessness later. But they might become bitter and angry if their rewards never presented. So it's like hoping to for someone, for something, to do something for us to become or to be happier. And so the interesting thing about this is that you're putting the control of your own life, or you put the responsibility of your own life in other people's hands, or in a given situation, or in a given event. So you're like actually losing the control of your own life.
Exactly. So those are the cognitive distortions. You know, a lot of food for thought there, and certainly, you know, if there are students in the audience, which there definitely are, there are certainly a lot of topics there for final module projects, for potential, you know, research projects as well. We looked at those distortions, but let's have a look at how CBT kind of handles and looks at you know, the problem-solving side of those distortions in terms of outlining the key techniques used in CBT. And we've had some questions come in, and we'd encourage a few more questions as we push to the halfway mark now. In about 15 minutes or so, we'll get to our Q&A today. So please send your questions in. We've got some really good ones. We do expect you guys all to be asking some great questions. So get your critical thinking hats on and get your questions into us, and Michael will send those through to me. Now, the first technique that we're looking at is journaling. What's journaling?
Well, basically, it's just write down the thoughts that you have in one day, 1 week, 1 month, over a period of months. It's just like this will help you. This will help you identify the kind of like the thinking patterns that you have in a given period of time. So that's really good, because in that way we can make something kind of abstract for the client into something concrete, and therefore he or she can see what's happening in her mind or his mind.
I mean, I think you know, it's a very powerful tool, journaling. Not enough people are, you know, keeping journals and writing stuff down. You're not only, you know, from the perspective of having, you know, issues, but also, you know, just generally being able to look back and kind of see the development of your thoughts and ideas over time. It's kind of a lost art, journaling, and can be very powerful.
Yeah, it's really nice, and it's very powerful, and it's been shown to be like extremely effective, and that actually links to unraveling cognitive distortion. So the extent to which you could identify further thinking patterns, then you will be able to unravel the distortions that you have in your thinking, and that will help us to evaluate the extent to which those thinking patterns are healthy or not. The extent to which those thinking patterns are making you feel sad, happy, angry, etc.
Exactly. And we have here, you know, unraveling the cognitive distortions you hold. You've got to be aware of the distortions you're most vulnerable to. You know, how do you identify those? I mean, it's through the writing it down and, you know, observations from others. Now, how do you kind of understand what you know, what are the issues that you have yourself?
Well, you know, just to give you a silly example. For instance, a client might come and tell you like, well, I haven't been feeling very well this week because I wasn't able to hand in the annual report, which was like very important for my boss, and therefore like they gave me an opportunity to do it again, and I can handle it next week. But I feel like very anxious, and I feel like very sad because I'm not performing at the best, and also that has an impact on my family, because whenever I went back home, and then I thought like, I'm not very good at my job, so I'm not going to be a very good husband tonight, and therefore you act as like very sad, a very sad person, and then you think that you're like you have no value in life because of what happened in the workplace. So we help the client identify where the distortion is. Certainly, she or he is not going to be fired because of not having handed in the memorandum of the annual report. Certainly, she or he is not going to have like a bad day back at home because of what happened in the workplace. So whenever we work with thinking patterns, we try to help the client to identify where the distortion is. And the whole story that they share with you, they're like specific distortions which you use then to unravel and to actually question them and challenge them.
Well, this is unbelievable. I mean, we have the next one, which is kind of, you know, the kind of programming part I really like this, you know, cognitive restructuring. You know, Beck, you know, Beck again. How do we kind of rewire our brains? I mean, it's, you know, sounds very complex indeed. How does cognitive restructuring work, you know, at a practical level?
Yeah, for instance, this in order to cognitively restructure your schemes, first you need to identify. You identify, for instance, that you think that you're going to be fine because you didn't have this annual report. Then we look for more for healthier ways of thinking, so we can ask the client. So what do you think? Like, what will happen? What will be the worst case scenario if you don't hand it that report? And say like, well, I don't know, maybe they're going to fire me. Well, they haven't fired you. They haven't fired you even last year because you did the same thing. I don't know, the last month you did the same thing. So what do you think would happen? So like, well, so whenever you challenge that, they realize like, oh yeah, that's true. The consequence I thought it was going to happen, they're going to fire me because I didn't hand it in the deadline. Didn't happen. Therefore, then you cannot help them to rationalize it and say like, well, if that didn't happen back then it's not going to happen in the future.
So you change the underlying assumptions to break, you know, these kind of cyclical
cycle. Yes, there's a cycle.
Unbelievable. Exposure, this is an interesting one as well. Exposure and response prevention. You know, we kind of all seen those shows where it's like, well, if you're scared of spiders, you go take a bath in spiders. If you're scared of heights, you go, you know, go to the top of a tall building. And I'm a bit, you know, this is a bit crazy. This sounds horrible. A gradual and systematic exposure to distress-producing stimuli without engaging in associated rituals of avoidance. It is a treatment which involves being exposed in a very structured way with the support of your therapist to what makes you feel anxious and not carrying out compulsive rituals after exposure. I want to show you the next point because I kind of want to talk about them both at the same time. That's different from what you call here interoceptive exposure. Exposure to bodily sensations. Interoceptive exposure is an important component for treatment, especially for panic, but for any problem where normal body sensations are experienced as threatening. So what's the difference here? Is one more is interoceptive more about physical stimuli, and the other one's more about mental stimuli? How does it work?
Interoceptive is the kind of information that you get from interoceptive sensors, and which are like in your body, and that tells you kind of like the physical state of your body, of your and these can trigger like thoughts of like, oh, I'm feeling quite anxious, or I'm hurt, and I have a terrible stomachache, and then therefore that might mean something, right? And the exposure and response prevention is, this has to be carefully done by a psychotherapist, because you're like kind of helping the client by using imaginary to kind of like approach to the event of the situation of the person, which kind of triggers that sort of low anxiety, for instance. So yeah, so you work with the client, for instance, like if they have a problem with like, I'm not gonna go to my home now because my husband's gonna be angry because I didn't prepare dinner tonight, and then we will work with the client step by step and little by little, and trying to expose and trying to bring that scenario by imagination, so we can see how we can restructure the way in which the person and the individual responds to that. So there's a good point here to mention that the bodily reactions are certainly triggered by the nervous system, right? So there's been a great debate in the literature with regards to what triggers what. Now let's take, for example, depression. They used to think that depression was like it's correlated. Well, we know that there are like a range of neurotransmitters playing a role in depression. Then serotonin goes down, dopamine goes down, oxytocin goes down, and yeah, but that has been triggered for something, right? It's not like that just your body reacts, or just your body commands and tells you like, I'm down on serotonin, I'm down on dopamine now, think that you're sad. No, it works the other way around. It works the other way around. So the way in which there's a lot of neuroscientific research which supports the notion that the way in which we think releases a range of neurotransmitters and releases a lot of like and hormones and acting upon a range of organs. So it is very basic to understand, and it's important to understand that the way in which we are thinking is connected to our nervous system and even to our immune system. So therefore, if I feel sad, I'm going to release less serotonin or dopamine or oxytocin, and then I'm going to feel down. So that the bodily reaction is the outcome, right? Is the outcome. But most of the times they kind of like want to tackle the bodily reaction, like don't feel depressed, I'm going to give you like some pills so you can have like dopamine up. But that's not the root of the problem. The root of the problem is the thinking pattern.
Exactly, and yeah, there's no chemical solution to changing your underlying assumptions or thinking pattern. Nightmare exposure and rescripting. So exposure to and rescripting of nightmares is a helpful technique for taking control of bad dreams. There's evidence that imagery rescripting for nightmares can be used as a standalone intervention. There seems to me, by the looks of this technique, that there's quite a large amount of role playing involved in these sessions in terms of playing scenarios out. Okay, what if this happens then? How do you feel then? Okay, is that the worst thing that could happen? What about, is that how you do it? And how does a therapist kind of train to do that?
Well, that's a very good point. First, you need to be trained to identify those automatic thoughts, right? And then you need to be trained to, with regards to how you can evaluate and how you can challenge them, or how you can help a client to challenge such assumptions as well. And therefore, this calls for the need to have like a specific knowledge with regards to the and not only the way in which your mind works, but the way in which your body work as well. So you need to know about anatomy, physiology, biochemistry, etc. But yes, certainly we are like placing the client in a place where they actually think and rethink about what they are thinking. So it's also embedded, if you want to see it this way, it's also embedded the way in which you kind of like develop metacognitive skills, so the extent to which you can see how you're thinking or how you're doing things. So yes, the clients are exposed to that. Just it's gradual. It has to kind of be like just like that way.
Well, I was also reminded of this kind of critical reflexivity skill that they're teaching us academically as well, and in order to stand above ourselves and kind of look at our behavior as it happens and kind of analyze and manipulate and change that behavior as it happens. It's quite an important skill.
Yeah, definitely.
That's good. Well, these are some of the techniques, Angel, that might be able to help you with that kind of control. What's progressive muscle relaxation?
Yeah, well, it's a technique which is used for eliciting the relaxation response and relieving muscular tension. So you will also help the client to, and this actually is linked to the relaxed breathing. So you help the client to become aware of his own or her own breathing and his own or her own muscle tension. So you identify them, you help them to identify that, and then you help them to control first the breathing, and therefore that will have an impact in how you can control the tension that you have in your muscles. So it goes, you need to see this from a holistic perspective, Joe. Like it's not just like about working with thoughts, it's about working with the body as well.
Nice, body and mind. It's interesting, Angel. Yeah. Last time we had a session, which is available on YouTube, is we had a psychology student in Marco, and we looked at mindfulness and stress for students. And so this kind of progressive muscle relaxation, relaxed breathing, is also part of mindfulness as well, and can help people on the day-to-day. Now, how much of this stuff is practical for everyone, whether we consider ourselves to be heavily weighed down by our cognitive distortions or not? How much of this is just good practice?
I think that every one of us has this ability to identify these thinking patterns and to evaluate them, challenge them, and therefore change them. But you need to be taught how to do that. Unfortunately, what evidence suggests is that you learn the thinking patterns, and then you're like learning these behaviors early since life. You're like in the early stages of life, and therefore they will stay with you. So we know that clients can identify them, challenge them, but they need to be trained. Otherwise, I don't know, if this was like an innate ability of identifying my cognitive distortion, then I wouldn't have a job because I wouldn't have clients. All of them would be healthy, right? So, but no, fortunately, no. The culture permeates the way in which you think, the way in which you listen, the which you behave. So no wonder. So just to illustrate the impact of culture in mental health problems, no wonder you have like a very high rate of mental health problems in the Western countries rather than the Eastern countries. Now, being the US one of the main countries where you can find a high rate of mental health problems. No wonder why they also developed all these criteria for the diagnosis of mental disorders. An interesting fact, for instance, you can see is that in 1920s, for instance, in psychiatrists, they have like nearly 20 or 30 disorders, diagnoses and disorders and criteria. But nowadays they have more than 300. Oh. So that only tells you that, I don't know, there's a lot of critique about the field of psychiatry in terms of labeling, which leads to mental health problems as well. Exactly. So, yeah, that's how the statistics stand for now.
Yeah. There's a huge book out there called Madness Explained. It's like an encyclopedia. It's one of the big books in the industry. And
that's interesting. That's really interesting.
If you look at that, you'll realize that we all have, as we know, we all have distortions of our own, and we can all diagnose ourselves with a mental health problem if we look hard enough, because there is no normal. There is no middle ground. It is grey, as you say. Let's look at then how we pull it all together on our fantastic, psychology course. How is our module structured, and what kind of things can students expect to learn about CBT on our courses?
Well, this module is one of my favorite modules. I just love this module, and actually we expose students to a range of evidence with regards to how the CBT approach evolved and what the principles of the CBT rely on. So they're going to be analyzing cognitive therapies and behavioral approaches as well. They will also analyze the influences of the effectiveness that has been shown in different studies of the CBT in different disorders such as depression, post-traumatic stress disorder, generalized anxiety disorder, anorexia, bulimia. So students critically analyze the evidence available with regards to the effectiveness of this approach, so they can become more trained, more knowledgeable about the implications of this approach and how different mental disorders develop and how clients could actually be helped and supported. Then we also review and analyze intervention techniques. We also analyze the kind of like the cross-cultural application of the CBT approach as well. As I mentioned, it's not the same in Asian cultures, in Latin American cultures, or the European cultures. It's not the same, the kind of like the social factors having an impact on the individual's way of thinking. So it greatly differs because it differs on beliefs, religion, values, and it differs a lot. So we actually train our students to identify these commonalities and differences across cultures so they can see how they can actually implement the CBT approach. And finally, we teach students how to systematically assess the evidence regarding the CBT. So there's a wealth of research about this approach, and they have even conducted randomized controlled trials, which is called the standard in science. And they have so those studies have shown like that this approach is quite effective as well for a range of disorders. But again, we need to be critical about this as well, and it also has its limitations, right? We need to acknowledge those limitations, and they are like well documented in the literature. But yeah, that's how our students are trained in our module, and I welcome you to apply to that module. Come here and study this.
Exactly. I mean, I know it's a very, very popular one coming towards the end of your course as you kind of round up your modules moving into your research project. So that's a nice one to pick up along the way. Certainly stimulates a lot of our students to go on and kind of pursue this research for their research projects as well. Wow, we got through it all, Angel, in 45 minutes with 50 minutes to spare for questions as well. And we've had lots of questions come in. Thank you very much to our audience members for those questions. Thank you, Michael, for fielding those questions in the background as well. Let's have a look. I haven't seen them before, Angel, so we'll have to just go through them as they are and see if we can kind of decipher them. Yeah, interesting. You're talking about culture. How is filtering via culture managed? I have to take care of the whole family, otherwise I am bad, as an example.
Well, that's a very interesting example. That's a very interesting example because you can actually see how the should and must work in that regard. For instance, and you can see actually this in societies, in different societies. So we have collectivist societies, which are more like in the in Latin America, it's very collectivist societies, whereas in Asia you can find individualistic societies or European. So one of the expectations, for instance, one of the cultural expectations is that you, as a son or a daughter of your parents, in a collectivist society in Latin America, for instance, you're expected to help them, to live with them for all your life. Like even you're like 30 or 40 or 50 years, you're there to look after them. That happens. It happens the same in Asia. So that's why you have like big families and they have like big houses, you know, to have all the family there. But individualistic societies, such as like the European one, you're not expected to do that. Therefore, you're not seen like, oh, you're a bad son because you left the university at 18. No, it's not. So you're not filtering. You're not saying like, oh, this is bad, this is wrong. I'm a bad son. I'm a bad daughter. No, because it reflects your cultural, the cultural influences. So yeah, culture plays a major role in this.
Exactly. I mean, I have some Asian friends who might have had some non-Asian girlfriends, let's say, and their parents are hoping that they have, you know, wives from the same culture, or they married, you know, maybe some arranged marriages as well. And that's, you know, that's interesting. You know, they're living in Western culture, but their, you know, their families are from Eastern culture, and then they kind of have a different perspective, or they filter their information differently on what they consider is, you know, are they honoring their parents or their culture, or, you know, are they honoring the culture that they've come into living in the West? So do you see that as well? That kind of dichotomy as well for you, Anga, when you have like people whose maybe parental culture might be more traditional, but their personal culture might want to be more individualistic, per se.
Yeah, you see that all the time, especially with international couples. So and that's very interesting because they need to get together. They need to reach agreements as to how to decide. I don't know. Let's take for instance how to raise a child, right? Because if you married like a Westerner or an Easterner, she or he will have totally different ideas as to how to raise a child, for instance, and that will have direct impact in the child's thinking, how he behaves or how she behaves or how he thinks, how she thinks that good things or appropriate things are done. So yeah, one of the best advice is like communicate each other and reach consensus as well.
Wow, okay, so we've got another one, a long one. If CBT is about recognizing cognitive distortions and then evaluating and modifying behavior accordingly, surely a big help to mental health would be to teach children about these distortions and how to recognize them when they're young. Should this be taught at schools? And if so, to what age would it be effective? How young is too young to recognize these distortions? Yeah, can you teach your child, you know, you're blaming here, and you know, it's not right to blame, you have to take responsibility, and this is how, you know, how do we kind of bring these techniques in?
Wow, that's a very, very interesting point. Yes, I would totally agree in the fact that we need to teach these sort of strategies at an early age. But in order for a child to identify his own or her own ways of thinking, we need to train parents first. And we might need to train teachers as well. So certainly, and this is one of the main arguments I do in my conference, and actually I was in Italy last month, and I went to a conference of early childhood, and one of my main arguments was like, we're focusing on so much academic stuff. We're focusing on international competition of academic performance, but we're forgetting about, you know, well-being, how to be happy, how to deal with problems, etc., etc. So we are, yeah, I don't know. I think we're leaving out a range of good things that we can teach our children, so they can we can prevent these mental issues to further develop.
I've got an interesting question. Two questions I'm going to kind of combine. One is asking, you know, can CBT be used to create, you know, more serious disorders? And the other one is, I'm trying to design research on how CBT can prevent or avoid people becoming schizophrenic, which is interesting in itself. So, what do you think of that in terms of CBT being used, you know, for some stuff that might be considered an innate disorder or something that can't be, you know, just looked at rationally?
Yeah. Well, first of all, we need to consider that CBT has been shown to be very effective for mood disorders, right? Now, if the person mentioned schizophrenia, so how can I develop a CBT? Did she say, or did she say something about how to prevent schizophrenia?
Prevent or avoid people becoming schizophrenic. Yeah.
Oh, wait. Yeah, prevent or avoid people becoming schizophrenic. Well, we might need to consider the biological component of schizophrenia, right? Okay, because there's evidence which suggests that there's like genetic components in schizophrenia. So there's a distinction, whereas the CBT heavily relies on working on your thinking patterns and your behavior, biologically related illnesses need to be treated in a different way. Certainly, you can use CBT, but schizophrenic, I'm not a specialist in schizophrenic patients, but you certainly need medication at that point as well, because they have like a biological component. So yeah.
And there must be a lot of mixed methods, obviously, that are being used as well. An interesting one. This is something I thought that it must be very good for or helpful for. Can CBT used to help someone recover from or handle different types of addiction, drugs, alcohol, gambling, etc.?
Yes, Yes, of course, yes, yes, for addictions. Yeah, yeah, yeah. The CBT is it's been shown to be very
Very
effective in
popular.
working with addictions as well. And yeah, there's a range of studies showing positive results, even compared to other traditional approaches. So, yep.
Ah, interesting one here, more personal, and we appreciate people sharing this. My daughter's CBT therapist says she doesn't like labeling. In other words, allowing my daughter to believe that she doesn't have BPD. Is that part of the reconstructive process?
Oh, actually, that's a very good point. Yes, and I would agree with her daughter as well. Labeling, I mean, from a scientific standpoint, we need classification, right? We need labels just to classify certain criteria and categorize it, and in order to associate certain symptomatology to a certain kind of like behavior. However, there's a risk on that as well, because the moment you tell a child, or you tell the parents, for instance, that their child is suffering from ADHD,
Mm-hmm.
or that the child has developed PTSD and the post-traumatic stress disorder, so
Mm-hmm.
that
Mm-hmm.
child is going to behave accordingly.
Yeah.
That sounds like interesting, but it's sorry. It sounds fun, but it's interesting to see how, if I am told that I am stupid at school, stupid at doing homework, I'm going to believe that, and therefore I'm going to behave accordingly. So the same happens with labels. Exactly, you reinforce that. So labels is very tricky
Dangerous.
area.
But at the same time, there's the opposite as well. There's admitting and understanding and knowing who you are, and taking ownership of issues that you might have that might never fully be resolved. I mean, if you think of people on the autistic scale or things like that, there has to be an acknowledgement of the situation you're in. But at the same time, there's that danger that it defines you. So in this case, telling a young woman, don't know the age of this one, but telling a young woman she's got bipolar disorder that could become very definitive. When I was growing up, it was the 80s, and ADHD and Ritalin and all these things weren't really on the scene. And I've always thought that I was very hyperactive, and my attention, my focus would flip from one place to the other, and I'd find it very difficult to concentrate. And then there'd be a few things like music and other things that would help me focus and concentrate. I think if I was born now, my son's age, I think I would have been diagnosed with ADHD, and then I would have been prescribed all these focusing drugs. And then the idea of that terrifies me. So, I mean, how do we kind of reconcile that, Angel? When is it better to say, actually, it's not better for me to go into a long, drawn-out deep dive into my psychosis, and it's better to kind of have a lighter understanding and move on and be more practical about things? I mean, when is intervention necessary?
I think that the best piece of advice I can give is like, I don't know, if you are an adult and then you're kind of like identifying that you feel like have some problems with that, well, just look for counseling. But if you're a parent, for instance, and you are like concerned about your child's behavior or something, then I think the same applies. Go and look for professionals. They need to be accurately diagnosed, okay? The first things that I do, for instance, is that I need to refer them to the GP, for instance, and then we need to rule out any sort of like biological related issue. Once we are free of any sort of like biological factor, then that would suggest to me that most of the time, most of the problems are here in the mind, right? So it's about the cognitive processing. But for instance, in autism as well, there's a biological factor there. Schizophrenia, there's a biological factor. Bipolar disorder is a biological factor. So there are different things, but they need to be very carefully diagnosed.
Perfect. I think we'll, as we come to the top of the hour, we're going to do just a couple of questions before we finish the session. We've had so many questions, so thank you very much for your questions today. And I think this one is one that will resonate with a lot of people. Any thoughts on using CBT as a method for burnout prevention, especially in the first levels of burnout, e.g. how employees think about conflicts and learn to restructure to relax more often? Maybe an interesting departure for a research project, CBT in the workplace. Has this got legs, Angel?
Yeah, definitely. That's a very good point. Yes, certainly you can prevent burnout by applying the range of techniques which are used in CBT. Yes, because burnout is just the result of how you're like coping with the stress sorry, we're coping with the situations around in your organization, in your workplace. So if you feel like you're you have a lot of work, but you don't have the coping skills to do this work, then you will think that you will start feeling stressed, and therefore you will start releasing cortisol. You see, so the way in which you thought you perceive in social situation, it would lead to a biological component. Then you release a lot of cortisol, and then you will feel like, oh no, I really need to do that. I really need to be good at this and stuff. So definitely, yeah, and that would lead to burnout. So definitely, we teach or employees or co-workers, and we train them with these sort of techniques. I think will greatly help to avoid burning out in organizations. It would be better. It would be better if we didn't put like a lot of workload in other organizations in industrialized societies. Culture matters.
Exactly, culture matters. And one last question to finish the session today, and thank you very much for everyone's questions today. And this is, this is the golden question. If you could answer this, I suppose you'd be a billionaire, Angel. How do you approach someone who isn't thinking rationally? What are some of the best tips to approach someone who might not be thinking rationally?
Well, first of all, if you are saying that a person is not thinking rationally, so that might suggest that you have already identified rational thinking of that person. So, well, identify those, work with the client. You need to, if you need to, just write it down. As a client, to write it down to get a journal, and then work on that in the sessions. Yeah, that's quite quick because you already identified that you have a rational thinking.
Exactly. Well, there's been an action-packed session. We had a lot of questions asking for the presentation, and we're going to put the video up on YouTube this evening or tomorrow morning, so that will be available for you guys to go back through as well. We've had prospective students who might be thinking of our psychology courses, our fantastic psychology course. These are kind of discussions that you can look forward to in our classes. Those that are in our classes now are fully aware of that, and they're having those discussions currently. Hopefully you're stimulated a bit to think about some of your research projects, making some connections, and this will hopefully help you, in your workplace as well. Thank you very much, Angel, as always, for your insight. I hope to see you early on next year as we look to tackle another topic from our psychology program with you. So thank you very much, Angel.
Thank you very much, Jesse, for the invitation. Thank you, everyone who joined this session. And just my only recommendation is just be happy. Be aware of your thoughts. Don't worry too much. Enjoy life. That's it.
Exactly, that's it. And I can't say it better myself. Thank you very much. Been a University of Liverpool online presentation. My name is Joe Bryan. Thank you. We'll see you later.